Hello friends. Last week I have received one message from our subscriber stating that she wants to learn respiratory system combination codes. As all of us know, in medical coding, combination codes plays very important role. If you take ICD10 CM or if you take CPT, combination codes plays very important role. Sometimes it is very confusing how to choose appropriate combination code. So first we will learn what is a combination code. So combination code is a single code which will be used for multiple conditions or multiple codes. For example, if the patient is having unspecified asthma and COPD, here we don't need to code unspecified asthma separately and COPD separately. Just we will code only single combination code like J44.89. So if anyone wants to looking for jobs in India, USA and UAE, please join in our WhatsApp group. WhatsApp group link is in the description of this video. And also if you are looking for free AAPC CU webinars, please join in our WhatsApp group. Group link is in the description of this video. And also if anyone trying for CMJ Treasury training, please send message to 707-526-3939. So if you want to learn combination codes related to respiratory system, please watch this video until the end. After watching, if you like this session, please click on like button. So today we are going to learn all combination codes related to respiratory system ICD10 CM coding. For us, first combination code is unspecified asthma plus COPD. Here we need to code COPD using J4489. This is the new guideline we are following from 2023. Next combination code is asthma specified type plus COPD. Here we need to code both asthma specified type as well as the COPD code. So basically here we need to code two codes. So next combination is asthma unspecified exacerbated plus COPD. Here also we need to code asthma unspecified exacerbated plus COPD. So here also basically we need to code both codes using J4489 plus J45901. Next combination is asthma specified exacerbated plus COPD. Here also we need to code both codes like asthma specified exacerbated plus COPD code. Next combination is asthma unspecified plus COPD with lower respiratory tract infection. So in this scenario, we need to code only COPD with lower respiratory tract infection ICD10 CM code, which is J440. As asthma is unspecified here, we are not going to code asthma along with COPD with lower respiratory tract infection. Our next combination code is asthma unspecified plus COPD exacerbation. As usual, if we are combination codes of unspecified asthma, we will not code unspecified asthma. In this scenario also, if the patient is having or documentation is having unspecified asthma plus COPD exacerbation, we will code only COPD exacerbation using J441. And as usual, in this scenario, we will not code unspecified asthma. So these are the combination codes mostly related to COPD with asthma. Now we will see combination codes related to emphysema with COPD. For example, your documentation is having unspecified COPD plus emphysema. How do we code here? Here we will code only emphysema, as emphysema is specific type of COPD. So here we will code only emphysema if the patient is having or documentation is having unspecified COPD plus emphysema. So next combination is COPD exacerbation plus emphysema. So if the documentation is having COPD exacerbation as well as emphysema, we need to code both, like COPD exacerbation as well as emphysema. Why means here COPD is not unspecified, COPD is exacerbated. So we need to code both exacerbated COPD as well as emphysema. Next combination is COPD with lower respiratory tract infection as well as emphysema. So just think like that your documentation is having COPD with lower respiratory tract infection as well as emphysema. So how do we code this scenario? So here also as usual, as here also COPD is exacerbated with lower respiratory tract infection. Here also we need to code COPD with lower respiratory tract infection as well as emphysema. So these combination codes are very important for your live coding as well as interviews also. If you are planning to write CPC certification exam or CCS certification exam, these are the most common questions you will encounter, as well as during interviews also. Most of the time interviewer will ask all these type of combination codes. Why means these are very confusing. But in this video we have learned all the combination codes. You don't need to worry. So now onwards I hope you are comfortable of coding respiratory system combination codes. So if you are having still any confusion, please mention in the comment section of this video. I will create separate video related to your comments. And now we will see few definitions related to COPD, asthma as well as emphysema. So the full form of COPD is chronic obstructive pulmonary disease. Most of the time COPD is related to the lungs. Because of damage to the lungs, patient will get this COPD. Because of this damage to the lungs, patient will have limit to the airflow into the lungs. So mostly asthma is related to the airways. Asthma is a chronic condition. Because of this asthma, patient is unable to breathe properly and patient feels very difficult while breathing, which is the resultant of inflammation of airways. Because of this asthma, patient will have narrowed airways. Because of this narrowed airways, patient is unable to breathe properly. Next we will see emphysema. So emphysema is mostly related to alveoli. Alveoli are the tiny sacs in the lungs where exchange of gas occurs. So if the patient is having emphysema, their alveoli become and damage the alveoli valves. Because of this, patient is unable to breathe properly. So if you observe here, COPD is related to the lungs. Asthma is related to the airways. Emphysema is related to the alveoli. So based on location, we are having COPD, asthma and emphysema. Most of the time, the treatment for all these conditions is same. Mostly in the live coding, we will see albuterol and spironolactone. Okay friends, thanks for watching this video. If you like, please click on like button. And also if you are having any confusion or doubt, please mention in the comment section of this video. And also if anyone looking for same day surgery training, please send WhatsApp message to 707-526-3939.